And good afternoon. It is Friday and it is time for our regular Lunch and Learn. Now today we're going to be talking about salt. Now the report references table salt, which I am not a fan of. However, there are 13 different tissue salts, of which sodium is a pretty important one. So the report is going to talk about table salt, but just in your mind, know that holistically, we're talking about the 13 different tissue salts, of which sodium is one. Okay, so we're going to be talking about this. Now, sodium is a property of table salt for sure. Salt, salary comes from salt. They used to use salt as a monetary unit of measure. And so that's why we have sayings such as, he's not worth his salt. And so salt has been around as far as 6000 BC. And there used to be places where you could go for health benefits called solarium, and they were salt caves. And so salt is very, very beneficial to our diet. And as I was reading this report, I had a misconception, like maybe you do too, that you can always have too much salt and we have to guard against salt. However, while that may be true with some people, very many people are salt or sodium deficient, and we're going to talk about some of the things that can happen to us when we are sodium deficient. Now, I didn't understand that that could even happen, but sodium is really what we need to maintain all of our life functions. Sodium is one of the electrolytes, and without it, we will die. So one of the things that sodium does is it balances our tissue fluids, and it goes where water goes, or maybe more importantly, it takes the water where it needs to go. So you may know, you may not know, that our body is an electromagnetic, for lack of a better word, bioorganism. That means that we run on electricity. Now, you will know that if you are looking at your brain waves, or if you're looking at your heart EKG. Those are electrical waves, and so don't let anybody tell you that we don't need the sodium or the electrolytes, all of them, the 13 tissue salts, and water in order for our bodies to work the way they need to work. And so many people will come in and they will say, well, I drink about 16 ounces of water, or I drink about 40 ounces of water. Well, that's good if you weigh 80 pounds. I don't know very many adults that weigh 80 pounds. I know a couple, but most of us weigh far more. I weigh far more than that. And so in order for our body to do all the things that it needs to do, it has to have the electrolytes and it has to have water. So sodium is responsible for the transmission of signals in the muscles and the nerve cells. Without adequate levels of sodium, our nerve cells will fail to fire. So we need our nerve cells. We need them to be on point. We need them to fire when they need to fire. Think of your automobile and your spark plugs. And when your spark plugs don't fire the way they need to, then your engine has trouble. And it is the same with us. Sodium allows our muscles to contract and to relax. And so if we do not have enough sodium in our diet, then we're going to have problems with that. Your heart and your lungs are muscles. And so if we don't have enough sodium, then we may have trouble with that as well. Now, in your table salt, you've got, I think it's NaCl, right? So you've got sodium and chloride. The chloride is what produces the hydrochloric acid, or helps with the hydrochloric acid in your stomach. And so as we get older, we stop producing hydrochloric acid, or the hydrochloric acid reduces, and so we're not able to digest our food very well. And this is why some people of a certain indeterminate age will say, well, I don't eat meat anymore because I just find it very difficult to digest. If you had more HCl, hydrochloric acid, in your stomach, then you may not have that problem. And so, we need all of these tissue salts in order for our bodies to do what they need to do. The secretion of digestive fluid also requires salt. So again, I'm using salt not just as sodium, but as in all of the tissue salts. This is why holistic people, they always want you to do Himalayan sea salt, Celtic salt, because those have more of the 13 different tissue salts in them. They're not as salty to the taste, all right, so you can have more of it, but they provide more additional nutrients than just regular old table salt, all right? So we have already talked about how the chemical name is NaCl, okay? So we need to know that this particular product that we have on our shelves, on our table, does not contain all of the nutrients that we need. Now, the sodium content that an adult male needs is 92 grams, all right? 92 grams, that's a lot. Half of which, 46 grams, is found in the extracellular fluid, plasma, and blood. 11 grams is located in the intercellular fluid, meaning 35 grams is found in your skeleton. So that's a lot, 92 grams. That's a lot, all right? Most of us had no idea. So to say that salt is, to be deficient in salt is a rarity is not necessarily true, because most doctors do not look at the data that says whether we are consuming enough salt or not. So Dr. James, I'm trying to remember what kind of doctor he is, Dr. James D. Nicolo Antonio, say that 3 times fast, is a cardiovascular research scientist and doctor of pharmacy in St. Luke's Mid-America Heart Institute in Kansas City, Missouri, and he is the author of a book called The Salt Fix. For many years, he studied the impact of salt on the human being, and since 2013, he has published 15 different research papers on salt in the academic journals. He says that the misconception that people do not lack salt is due to few people undergoing proper salt deficiency testing. So low sodium levels in the blood are the most common electrolyte abnormality among hospitalized patients. He also stated that in the United States, millions of people are diagnosed with hyponatremia every year. So that is low salt. Additionally, millions are hospitalized because of hypovolemia. Now, all of these words, right? Hypovolemia is low blood volume. That means that you just don't have enough blood to go around, all right? And many times that is due to lack of salt. Why is that? Because salt brings the water, and you need water in your blood, okay? So if you separate out your blood, you've got your plasma, you've got your white blood cells, you've got your red blood cells, and all that kind of stuff. So people who are sodium deficient have low blood volume, and they have low sodium in their blood. So when the blood sodium is abnormally low, this is an electrolyte anomaly, and we see this both in inpatient and outpatient. So that means you go to the ER and you're actually in the hospital. Low salt intake is considered one possible cause of hyponatremia, according to an earlier study. Low salt intake, high water intake led to the hospitalization of 5,259 people in England between the years of 2006 and 2007. Now, people will tell you all the time, drink copious amounts of water, and that is not necessarily what you need to be doing. We do need to be drinking 1/2 of our body weight in ounces. So if I weigh 100 pounds, then I would drink 50 ounces. That would be my optimum intake. Now, if you drink a lot of alcohol, if you drink a lot of soda, if you drink a lot of coffee, then all of those things are diuretics. And so you're going to need to replace that and have additional water in order to make up the difference in that. But we do have people that are not very heavy that are drinking gallons of water a day. And what that does is it depletes your salt. Why? Because you're running to the potty all the time. And so that can contribute to a low sodium level in the blood. So when you've got hypovolemia, this refers to a decrease in the extracellular fluid volume when the loss of salt and liquid exceeds the intake. Salt plays a crucial role in maintaining adequate blood volume, ensuring our tissues are filled with oxygen-containing blood and nutrients. So researchers at Johns Hopkins University conducted a study in which they measured the plasma-specific gravity of more than 300 individuals. Now, your specific gravity is a measurement that we take to see if you are dehydrated or not. These 300 people included young adults, retirees, and older patients who were sent to the emergency room. Among the older emergency room patients, 40% had probable or confirmed low blood volume. Even among the young adults and older individuals who did not report any abnormalities, 5 to 8% had low blood volume respectively. Now, the salt rocks inside the, I'm not going to say this right, Kewra salt mines, Khewra. I don't know how you pronounce that. The world's second largest salt mine. I don't even understand what this means. I'm sorry. It says, even among patients and older individuals who did not report any abnormalities, 5% and 8% had low blood volume respectively. Salt rocks inside this salt mine, the world's second largest mine. It doesn't make any sense. I'm sorry. I must have mistyped something there. So low blood volume may also be related to insufficient water intake. Older people are prone to volume depletion. Why is that? Because you don't have a thirst reflex. As you get older, you don't become thirsty, so you don't reach for that water. And so there are some people who don't get thirsty that are not older people, and I'm one of those people. And so for years, I've had to put a glass of water on my desk to remind me that I need to drink because I don't necessarily get thirsty. So older people, their thirst response slackens, and so they are even more problematic of getting the amount of water that they need. Dr. Jason Fung, who is a nephrologist specializing in type 2 diabetes, he says that dementia could affect the diet and the drinking habits of older people, leading to inadequate blood volume. So how many people do we know that are having dementia issues? Lots. Now, could it be just because they were sodium deficient? Could it be because they had problems with their, their thirst response? They're not drinking enough. They're not adding salt to their food. They're not eating. Older people don't eat as much. And so it could be that they're just having all these issues. Salt deficiency is not common in most parts of the world because salt is cheap, widely used, often added to flavor, to food for flavor enhancement. And we do use salt. I'm very much always one to ask for the salt shaker, but I tell you, I do not consume as much salt as this report says that I need to consume. So we're going to get to that in a minute. Older adults who live in assisted living facilities may have insufficient sodium levels in their blood due to their medication or their health conditions such as heart disease, kidney disease, cancer. Additionally, excessive vomiting, diarrhea, and sweating can result in sodium loss in the body. Mr. Pointed out that excessive caffeine consumptions, high temperatures, sleep apnea, diuretic use, and excessive consumption of plain water, low carbohydrate diets, and fasting can all lead to salt loss. Now, fasting is something that I do, and I do it regularly. I do it as a spiritual practice, but I also do it as a nutritional practice. I practice intermittent fasting. And one of the reasons that I practice intermittent fasting is it gives my body a break from digesting my food. So if you are eating all the time, if you are a grazer, and a lot of us are, and I have been at another time in my life, your body is always using that energy in order to metabolize the food, digest the food, absorb the food, and that kind of thing. When you fast, when you do intermittent fasting, then you're taking that burden off your body, and your body can do something called autophagy, which goes in and cleans up the debris and the cells. And so it's a really good practice for your health. You don't want to do it excessively, but it does cause you to have a sodium deficiency if you're not supplementing appropriately. So that's something that is really important. Hypothyroidism, normally, those people normally have a sodium deficiency. So when you go to the doctor and you say, I don't think my thyroid's working correctly, and they say, no, your thyroid is slow, and here's a prescription, they're not going to tell you to increase your sodium intake. And that may be all you need to do. The report doesn't say that that's all you need to do. It does say that there is a correlation between hypothyroidism and salt intake. So despite some dietary guidelines that recommend limiting salt intake for the general population to a relatively low level, less than 1 teaspoon. Now, I don't know anybody, well, I don't know anybody, but I don't take 1 teaspoon of salt in a day. I'm just telling you, it just doesn't happen. The recommended amount from numerous studies have shown that for non-hypotensive individuals or hypertensive individuals, those without cardiovascular health issues, maintaining a salt intake of 1 to 2 teaspoons per day is healthier. Now, when I read this, I had to do a double take and think, am I really reading what I think I'm reading? Because all of our information, our public information, is no salt, low salt, new salt alternatives, and that kind of thing. However, as this report goes on to say, if you do not have enough sodium in your body, you're not going to have the right hormones and all that. And so it is just mind opening for us to make sure that we see that there's more to the story than just the cardiovascular patients. Salt intake that is too low actually leads to an increased risk of cardiovascular event and mortality. So 1 teaspoon of salt is approximately 5 grams, of which 2.3 grams is sodium. So if you're using homeopathic or Himalayan sea salt or Celtic salt or whatever, then you're going to have a different kind of measurement there. But the study published in the European Heart Journal in 2020 examined sodium intake and life expectancy in 181 countries and found that sodium intake was positively correlated to life expectancy and inversely correlated with all-cause mortality. The study concluded that dietary sodium intake is not the culprit in shortened lifespan or risk factor in premature death. However, it also emphasized that these data are observational and should not be used as a basis for nutritional interventions. The detrimental effects of high salt intake on the heart are undeniable, but surprisingly, the consumption of too little salt can also increase your risk of heart disease. So you got to figure out what you're doing. Does anybody out there, raise your hand, does anybody out there have 1 to 2 teaspoons of salt in your diet? This girl doesn't. Now, if you eat a lot of processed food, if you go out to eat and you do a lot of fast food, then yes, maybe you do. I don't do that. I don't do fast food as a general rule. It's not that I never eat a burger. Okay, I'm not going to say that because sometimes I do. However, that's not my everyday. My everyday is not processed food. My everyday is not fast food. My everyday is raw food, or it is organic cooked food, and lots of salads, lots of protein shakes and that kind of thing. So I just don't get that much salt. So I'm going to have to kind of figure out a way to measure to make sure that I get at least a teaspoon of salt in my diet. So in a prospective cohort study published in The Lancet in 2018, involving nearly 10,000 individuals from 18 countries over a median follow-up of 8 years, revealed that the risk of cardiovascular events significantly increased for patients in the highest tertile of sodium intake, more than 5 grams per day. However, the risk of cardiovascular events also increased considerably for participants at the lowest tertile of sodium intake, less than 4.5 grams per day. So that means that the sweet spot is somewhere between 4.5 and 5 grams per day, which is about a teaspoon per day. Now, I could probably do an experiment and measure out a teaspoon of salt and use that amount on my food throughout the day and see whether I consume that whole teaspoon. But I'm pretty sure most days that would be a negative, all right? In a review published in Nutrients in 2021, it suggests that optimum sodium intake for the lowest risk of cardiovascular disease and mortality is between 3 grams and 5 grams per day. Researchers call that the sweet spot. Both higher and lower intake levels were associated with increased adverse health outcomes. According to a study in Nutrients, 3 to 5 grams of sodium per day is optimal. So there's no perfect perfect way to measure a person's daily salt take accurately. Some studies estimate it through dietary surveys, while others measure sodium in the urine and then use that indicator of daily sodium excretion. So I'm not going to measure your urine. You're not going to measure your urine. So that just doesn't quite work for us. I think the best thing that we can do is, like I said, take a teaspoon, fill it with salt, put it in a container, salt your food with that, see if you have a lot left over or see if maybe you need more. And so that'd be just a good, hey, where am I on my sodium intake? So the New England Journal of Medicine published a tracking study in 2014 involving more than 100,000 people from 17 countries. After a mean follow-up of 3.7 years, the researchers found that sodium excretion and the risk of adverse cardiovascular events and deaths followed a J-shaped curve. They suggest that the ideal daily sodium intake is between 3 and 6 grams, a recommendation that Mr. DiNicolatano supports. And I know I'm not saying his name right, and I apologize. Other research suggests that the daily ideal sodium intake is between 3 and 6 grams as well. One possible reason for this being the sweet spot is that low salt intake can stimulate the rise of hormone levels unfavorable to cardiovascular health, as well as an increase in total cholesterol and triglycerides. So, if this is a problem for you, cholesterol and triglycerides, you might want to see what your sodium intake is, because if it's low, it could push those markers up. And so that's something that would be easy to measure. Because heart disease and blood pressure is only one risk factor for developing these conditions, higher levels of these hormones can be quite deleterious. In fact, blocking these hormones forms the very basis of our modern treatment for atherosclerosis. So he's calling cholesterol and triglycerides hormones, which I've never heard him referred to as that. However, he says when we're giving the statins and that kind of thing, it is blocking those components in our body. And so that's something that we might want to think about. And everybody can adjust their salt intake. If you take too much, you can adjust down. If you take too little, you can adjust up. The trade-off is that you can lower blood pressure perhaps a little bit, but you're going to pay for that with the increase of these other hormones. The result is that you have lower blood pressure, but you could have a higher risk of heart attack. That just is counterintuitive. What is the point of lowering the blood pressure if we're going to raise the advent of heart attacks? All right. He uses a Japan and the United States as an example. He says, while salt intake in Japan is relatively high compared to the rest of the world, and even higher than in the United States, the risk of heart disease among Japanese people is much lower than Americans. Well, I would put forward that it's not necessarily the salt issue, but it is all the processed foods and the way we process the foods. The foods in Japan are not even nearly the same is what we eat here in the United States. And I know that what we eat here in the United States is very, very detrimental to our overall health because of all the additives, the GMOs, all those kind of things. And so I think there's a whole lot more behind the scenes than just the salt intake. That said, the researchers generally agree that consuming more than 2 teaspoons of salt has a negative health impact. And again, I don't know anybody that has that much salt, but if you eat a lot of processed food, then that could be you. That said, individuals with a salt deficiency may experience various discomforts. These symptoms are often attributed to other causes other than salt. So what are these conditions? Fatigue. If I had $1 for everybody that came in my office because they were tired, I'd have a lot of dollars, all right? Fatigue is a big, big deal. Muscle weakness, also a big deal, and muscle cramps. So this is a common sign that people have a salt deficiency, similar to symptoms seen in chronic fatigue syndrome patients. They pointed out that the lack of salt results in insufficient blood volume and circulation to the organs such as the brain and the muscle, leading to fatigue and muscle weaknesses. Additionally, salt deficiency can also reduce tissue fluid, which can cause muscle nerve endings to deform or contract, triggering muscle cramps and pain. Japanese researchers conducted a series of tests on 75 older people with low blood salt volume and 2,907 with normal sodium levels. The test included assessments for muscle mass index, grip strength, walking speed, and one leg standing time. That's where you look like a little I don't know can't remember what the bird is. I'm going to say a pelican, but that may not be right, that they just stand on the one leg, okay? The results show that even mild salt deficiency can lead to physical dysfunction, such as a balance impairment or a gait impairment, making these people prone to frequent falls. So if you have an elderly person who is subject to falls, who has balance issues, you might want to check their salt intake. And again, not just table salt. We want to look at holistic salt, the 13 tissue salts, Himalayan sea salt, or Celtic salt. Brief dizziness when getting up. Now, I do have that sometimes. I don't have it regularly, but I have noticed that sometimes happens to me. In some people, they experience dizziness when they stand up from a squatting or sitting position. This condition is known as orthostatic hypotension, and it may be caused by salt deficiency. People with this condition are frequently advised to increase their salt intake to alleviate their symptoms. Additionally, postural orthostatic tachycardia syndrome, it often requires a higher salt intake as part of its treatment. That's from that cardiovascular surgeon, okay? That's really important. He knows heart, cardiovascular disease, so that's just amazing. And a small-scale study of patients with unexplained fainting, the daily administration of salt for 8 weeks significantly improved and enhanced orthostatic tolerance in 70% of the patients. So 70%, that's a high percent. So if you extrapolate that, that would say that most of the population is probably low on their sodium intake. And that's probably because of years and years of no salt, salt alternatives, and that kind of programming that we've been getting from our health professionals. It is worth noting that those who responded positively to salt therapy had low sodium excretion in their urine before treatment, indicating a salt deficiency. Another symptom, headaches, forgetfulness, and mental confusion. How many people come in here and say, I've got brain fog, I can't remember. I was talking to my daughter-in-law this week, and she said, I swear to God, I can't remember one thing from 1 minute to the next. And possibly it's a salt deficiency. Salt plays a crucial role in the transmission of signals between the nerve cells. When the body lacks salt, neuronal function decreases. Now, neuronal function is what's going on in the brain. Your neurons are like spark plugs, and the information spikes from one to the other. It arcs from one to the other. So when you don't have enough salt intake, then that neuronal transmission back and forth is diminished, and that can account for brain fog, mental confusion, and forgetfulness. Okay, low blood volume can cause insufficient blood flow to the brain, which can cause headaches and forgetfulness. It's becoming even more crucial for the brains of patients with acute hyponatremia, low salt levels, that we get their salt intake so they are not having something called cerebral edema, leading to neurological symptoms such as seizures, impaired mental status, coma, and even death. Chronic hyponatremia patients also experience changes in the brain because it occurs gradually. They may be asymptomatic. However, they may also experience gastrointestinal symptoms, loss of appetite, and subtle neurologic anomalies. So that's something to look at with your older people. Another symptom of low salt or salt deficiency is depression and stress. So who of us are not experiencing stress on a regular basis? I mean, the economy, the world, what's going on worldwide. It can be very, very stressful, not to mention what's happening in our own families and all that kind of thing, because we're all dealing with all the things. I mean, I read another thing this morning about a school shooting here in Texas. And so all of these things heighten the general level of stress. And so the lack of salt can activate the sympathetic nervous system, raising the levels of adrenaline and noradrenaline. This in turn contributes to worsened sleep and increased stress. In a study involving older Japanese people, mild hyponatremia was also found to be associated with depressive mood. Depression is linked to the substance glutamate, which may be reduced in brain cells due to low salt intake. The lack of salt can result in the lack of sodium, calcium, and magnesium. Now, those are all part of the tissue salts, okay? Magnesium deficiency can induce depression and anxiety. Researchers have found that since the skeleton is the primary reservoir for sodium, calcium, and magnesium, when those are depleted, then the body will draw sodium from the bones. And when that happens, guess what happens? Osteoporosis and that kind of thing. And so that's something that's really, really important. A constant craving for sweets could be a symptom that you are sodium deficient. Now, also, we know that if you have a craving for salt, that also is an adrenal issue, and your adrenals need salt. So both cravings for salty and sweet can be a symptom of sodium deficiency. So we need to figure out what that means for each one of us. The body has an intricate and strict automatic mechanism to regulate salt levels. When the body lacks salt, the brain detects this and sends signals to the body, leading to a change in related hormones. These changes then trigger an interest and need for salty food. Conversely, when the body has an excess of salt or other hormones, then they promote a thirst response in order to dilute and get the salt out of the body. So your body is really, really smart. We need to pay attention to that. I would think it would be very good for all of us to try and measure how much sodium we're getting in our food. Like I say, if you eat a lot of processed food, if you eat a lot of fast food, you probably are not in the danger zone because those foods are notoriously full of salt. If you eat moderately to really healthy, then you may not be getting enough salt. So kind of look at what's going on. Are you confused? Are you forgetful? Do you have fatigue? Do your muscles cramp? All those kind of things. Because if those kind of things are happening, then you may need to increase your salt level. So I thought this was a really interesting report. It's a cheap report it's a cheap fix because salt is cheap. I mean, it's just cheap. And you can get that and you can add that to your food. Again, we recommend Himalayan sea salt. Salina sea salt is the best, in my opinion. It has most of the tissue salts and not anything else that you don't need. And so when you get those electrolytes in your system, then all of the systems in the body work the way they need to, provided you have enough water in your diet as well. So it is the weekend. I'm going to sign off for now. I'm going to say thank you for joining me. Thank you for commenting. Thank you for sharing. Thank you for doing all the things that you do. And I'm going to go and have some beach time. And it's going to be really restorative for me. You do what you need to do to have restoration for you, because Monday's going to come around again, and all the things that we need to take care of for our work and our families and all those kind of things. So rest, restore, recover, and then I will see you again next Friday.